everybody. I'm one of the hematologist-oncologists at Mayo Clinic in Jacksonville, Florida, and focus on multiple myeloma. Today, I'll be talking to you about this clinical trial results that were presented at the American Society of Hematology annual meeting in December 24 in San Diego. And this is regarding what's called a BCL2 inhibitor class of drugs with the drug called Lisaftoclax or APG-2575 with novel therapeutic combinations in patients with relapsed refractory multiple myeloma and also in patients with light chain amyloidosis. BCL2 inhibitors are an important class of treatment agents for multiple myeloma. It's a very important therapeutic target. We do not have any FDA-approved agents in this class at the moment, but you may have heard of venetoclax, which is an agent that has been studied in this area quite a bit. Lisaftoclax, which is the focus of this particular clinical trial, is, while currently an investigational BCL2 inhibitor, it is quite effective and induces what's called apoptosis or cell death in myeloma, both in cell lines and also in earlier phase clinical trials that has been seen. We also know that CD38 targeting, which is utilizing some monoclonal antibodies, is an extremely important strategy for multiple myeloma. And patients who have disease that has progressed after CD38 monoclonal antibody treatment tend to have a very short progression-free survival, and overall response rate is only around 30%. This will come in handy as I walk you through the clinical trial results. And I'm saying this about the CD38 monoclonal antibody from our own data of a clinical trial using the combination of elotuzumab, pomalidomide, and dexamethasone, where patients who had been previously treated with daratumumab-based regimen and had refractory disease had only about a 35% response rate and about a 3.7-month progression-free survival. So in this particular clinical trial, the design included patients with relapsed refractory myeloma who were treated with multiple different regimens based on this Lisaftoclax BCL2 inhibitor. But for the purpose of this clinical trial presentation that I did at the ASH meeting, we focused on Lisaftoclax with pomalidomide and dexamethasone for multiple myeloma, and also Lisaftoclax, pomalidomide, dexamethasone for patients with AL, light chain amyloidosis. The key inclusion criteria were that the patient could have had one or more prior line of therapy. There was no upper limit to the number of lines of therapy. The patients also could not have had any other BCL2 directed therapy within 4 weeks prior to getting on the study. So they were allowed to have prior treatment with BCL2 inhibitors, but just not within the past 4 weeks. It is also important to keep in mind that while BCL2 inhibitors have been mostly studied in patients with translocation 1114 only, this clinical trial was for all comers, patients who had 1114, as well as those who did not have 1114 mutation. And the primary reason was this previous data, or at least some signals we had received through phase 1 trial that this agent seems to have activity even beyond the 1114 patient subgroup. The primary objective was safety and tolerability, but also we were going to look at the recommended phase 2 and phase 3 doses. And then this was supposed to be studied both for the myeloma patients and also for the amyloid patients. The treatment characteristics for this, the study involved about 48 myeloma patients with relapsed disease and about 10 patients with amyloid. Important to keep in mind that the group of patients where this particular regimen of Lisaftoclax with pomalidomide and dexamethasone were studied was 41 patients. And out of these, 36 patients had evaluation for benefit or efficacy, but all the 41 patients were included in the safety analysis. The patients had 3 prior lines, median prior lines of therapy, but there were actually patients with up to 19 lines of prior therapy, so very heavily pretreated patients. When we talk about the previous lines of treatment, the patients had prior IMiDs or immunomodulatory drugs in 95% of the patients, and prior anti-CD38 antibodies, so that would be either daratumumab or isatuximab, in about 85% of the cases. And prior proteasome inhibitor, which is generally the family of bortezomib, carfilzomib, ixazomib, that was in 100% of the cases. So patients who had been treated with all of these prior most frequently used regimens, so 100% previously treated with proteasome inhibitors, 95% previously treated with IMiDs, and 85% previously treated with a monoclonal antibody against anti-CD38. When we look at the response rates, these patients had an overall response rate of about 64%. So that is very impressive. In heavily pretreated patients, 64% overall response rate in all-comer patients. I should also point out that we looked at patients specifically for translocation 1114, and within there, the overall response rate was about 75%. So all comers, 64% response rate, and those with translocation 1114, about 75% response rate, although that was a smaller group, just about 4 patients. We looked at the progression-free survival and the progression-free survival for all comers. Now, I should point out, this is a study that involved the study drug dose from 400 milligram to 1200 milligrams. So lots of different dose levels, but even when we put all of them together, the progression-free survival was about 9.7 months, so nearly 10 months. And it's important to keep in mind that the patients who got the higher dose, say around 1000 milligrams, had about a little more than 11-month progression-free survival. So heavily pretreated patients, even beyond 1114, and we are seeing 10, 11-month progression-free survival across different dose levels. Then we wanted to specifically look at patients who had had prior treatment with anti-CD38 monoclonal antibody, because I started off by saying that that group tends to not do very well. Even there, the overall response rate across different dose levels with this regimen of APG-2575 or Lisaftoclax with pomalidomide and dexamethasone was about 62%. And the response rate, progression-free survival in patients who had had previous treatment with daratumumab or isatuximab was again about 9.7 months. This is in contrast to about 3.5 months that has been reported with other regimens. So impressive results there. We looked at the amyloid patients also. Now, this was a smaller group, but Lisaftoclax with pomalidomide and dexamethasone in patients with amyloid. And 9 out of the 12 patients were assessed for response. And over here, the overall response rate was about 89%. And the when we look at just median time to response, as in how fast did these patients respond, because amyloid patients can take time to respond, this was actually less than 1 month. So quick responses. Of course, the drug works. Side effect profile is very, very important to keep in mind. So what kind of side effects were seen? So we clubbed the side effects by either hematologic or non-hematologic. I should point out that BCL2 inhibitors can be associated with what's called tumor lysis syndrome. They can have low counts or neutropenia. They can also have low platelet count or thrombocytopenia, and they can tend to have, as a class, the concern is about diarrhea, fatigue, rash, etc. So in this particular clinical trial, what was noted was that there was some neutropenia noted, but high grade was very little. Only 40% was grade 3 or higher. Similarly, anemia or low platelets were noted, not that frequent. And as far as non-hematologic side effects, so all of those other side effects of fatigue, diarrhea, rash, tumor lysis, etc., the incidence was very low. In fact, there were no cases of grade 3 or 4. And I should also point out that tumor lysis was not seen with this drug. When we look at, and similar trends were noted with amyloid as well. It was also very important to note that majority of the patients who stopped the treatment on this clinical trial stopped because of either disease progression or they decided to just transition to some other treatment. But side effect related stopping of the treatment was only in 2 out of the 41 patients. So less than 5% had to stop the drug because of side effect of the regimen. So in conclusion, this regimen of Lisaftoclax with pomalidomide and dexamethasone has demonstrated an impressive safety profile with a high, um, even with relatively higher doses, that has promoted longer duration of treatment. The patients who have been heavily pretreated, including even prior treatment with CD38 monoclonal antibodies, did very good with response rates. We also saw very good, impressive response rates in patients with amyloid, which is clearly an unmet need. And this clinical trial is still ongoing, and the plan is for a larger trial to happen in the future to be able to confirm these findings in hopefully a randomized study. For this, I do want to acknowledge the study uh, centers where all the study has been done, all the patients and their families, and of course, the physicians and staff involved with all the study sites. Thanks a lot.